If you're on Social Security, disability, Medicare, Medicaid, or food stamps, July was a busy month, and the month is not even over. And there's a lot of changes that have happened that I want to bring to your attention. There was a benefits increase. The Social Security Administration announced two rule changes that's going to affect how you receive your benefits. And then the cost of living adjustment for 2026, the COLA number that seniors have been waiting for all year. There is a forecast, and I'm going to bring you the latest. And then there are changes to Medicare and food stamps that you need to be aware of. So this is going to be a long video. Stay with me. I am Kwame Kwade. For 15 years, I've been helping seniors get the retirement benefits they deserve. I create content on Social Security, Medicare, Medicaid, food stamps, and any personal finance topic that affects seniors and their pocketbook. So if you are new here, thank you for being here. Do me a favor, go into the comment section and let me know your city and your state, because I like to know where you guys are watching my videos from. And if you've been watching this channel regularly, thank you for your continued support. I am glad you are also here. Now, there's a lot to cover, so let's dive into the first thing. So let's start with the breaking news about cost of living adjustment. So the Social Security cost of living adjustment obviously is the number that a lot of seniors wait for if you're on disability or Social Security retirement, spousal benefits, survivor benefits. This is what they call the Social Security increase. It is what helps you budget for the future. And so knowing what the COLA is going to be ahead of time gives you an idea of what you can expect your budget to be in the future. And basically, what the government does is that each third quarter, they're going to look at a list of goods and services, and then they are going to compare those goods and services to the previous year. And if there's an increase in prices, then your Social Security is adjusted upwards. If there's a decrease, then your Social Security benefits remains the same. There is no increase. So basically, over the last couple of years, if you've been paying attention, inflation has gone up, prices have gone up and stayed up. And so seniors are expecting higher than average cost of living adjustment. Well, the official announcement is usually in October after the third quarter inflation number has come in, which is July, August, September. However, there are credible organizations that, based on what's happening, they can predict what the COLA is going to be. And this has been going on for years. So some of these organizations are very reputable. The Senior Citizens League, for example, is known for being spot on when it comes to calculating or predicting or forecasting cost of living adjustment. So based on expert analysis, they are saying that this year, COLA, cost of living adjustment, is going to be between 2.4% and 2.7%. So the consensus of what that number is going to be is 2.5%. Now, there are reasons for this. Inflation remains persistent. And so prices have gone up for a lot of goods, transportation, food, housing, rent, utilities, prescription drugs, healthcare. And so there's reason for seniors to believe that cost of living adjustment is going to be higher. Well, if you look at the last couple of years, COLA was 8.7% in 2022, 5.9% in 2023, 3.2% in 2024, and 2.5% in 2025. So essentially, you are going to see a number in the range of where the cost of living adjustment has been over the last 2 years. So it's kind of somewhere in the middle. So you may not even see an increase at all based on what they're saying. So the low side is 2.4%, the high side is 2.7%. So what does that mean for you? If you are getting Social Security or disability benefits and cost of living adjustment is 2.4% or 2.7%, how does that translate into actual increase in your benefits? Well, if you're getting $1,200 a month and you get a 2.4% increase, that is essentially a $29 increase. If you're getting a 2.7% increase, that is a $32 increase. So it's not a big change. If you're getting $1,900 in Social Security benefit, which is the average benefit, if you take all the benefits that Social Security sends out on a monthly basis and you take an average for 2025, the average benefit is $1,005, $1,905. So if you are getting the average benefit and next year's cost of living adjustment is 2.4%, you are getting a $45 increase. If the COLA rises to 2.7, then you're getting a $51 increase in your benefits. So now there is a whole video that I can create on why the cost of living adjustment is so low and what can be done about it. But that is a separate video for another day. I'm going to create a video walking through why the current cost of living adjustment calculation is not using the right inflation index. And there are actually there's a push in Congress right now to try to change that. So I'm going to create a separate video, give you some background on what is being suggested and why I think that this current method of calculating your Social Security cost of living adjustment is putting seniors back further, because the past 10 years, seniors have lost 20% of their purchasing power because your cost of living adjustment has not caught up with inflation. And so I am going to create a video in the next couple of days to talk about that. In the meantime, what you need to know is that based on forecasts from experts, you are likely to see either a 2.4% increase on the low side and a 2.7% increase on the high side. The official announcement is going to start in early October. So that's when the Social Security Administration is going to come out and give you the official COLA rate. And then that rate is going to then go into effect in January 2026. So that is the news about COLA. Now let's get to the second big news of the month. As I said, July has been very busy and we're just halfway through the month. So there's a lot that has happened already. And the next big one is obviously what happened with the president signing the One Big Beautiful Bill. And if you're a senior citizen, there are a few things that you should pay attention to. The first one, obviously, is the tax deduction. There's a $6,000 tax deduction in the bill that would last from 2025 to 2028. If you're a senior age 65 and older, you can deduct $6,000 from your taxable income. If you're a married couple filing jointly, you can deduct $12,000. As I mentioned, this is temporary and the deductions phase out. Once you reach $75,000 in income, it begins to phase out all the way to 175,000. Now, if you're a married couple, it begins to phase out at 150,000. Now, not all seniors are going to get this tax deduction. Just the way it was designed is for seniors, number one, age 65 and older, and number two, if you have taxable income. So for about half of seniors who get Social Security benefits who don't make enough money to file taxes, you are not in this bill. Basically, this tax deduction does not apply to you. Now, does it completely eliminate taxes on Social Security? No. It will cover a large portion of Social Security taxes. So it's not immediate. It's not like you get your Social Security benefit and there's no tax on it. You have to wait till you file taxes to be able to take the deduction. But 80 to 90% of seniors who pay taxes on their Social Security are going to get some relief. But here's the most important point: it is not permanent. It is going to last for 3 years. And once the president is out of office, everything returns back to normal, which means that starting 2029, you are going to pay taxes on up to 85% of your Social Security benefits if you fall in a certain income category. So that's the biggest update on that. Now, there's a couple of things in the Big Beautiful Bill that seniors will benefit from. So I want to talk about that and give you dates on when they expire, because a lot of the things in this bill, believe it or not, are not permanent. So there is the no tax on tips, which if you are working and getting tips for income, you can deduct up to the first $25,000. That is also going to expire after 2028. Then there's no tax on overtime. If you are receiving overtime income, the first $12,500 is deductible, and that also expires after 2028. Now, if you're buying an American-made car, a brand new car, and you take a loan out of that, the interest on that loan is tax deductible. Also, is going to expire after 2028. And there's expanded child tax credit. So if you know somebody in your family that has children that are eligible, forward this video to them, because there's critical information they need to know about the child tax credit. Is going to be increased from 2,000 to 2,500. So there's a $500 increase, and that also is going to expire after 2028. So that is the tax portion of the big beautiful bill that you need to be aware of. Now, there are changes to Medicaid, Medicaid and Medicare. And so I want to talk about that next. I want to talk about the changes to Medicare that are happening in the big beautiful bill that you need to be aware of. And then I'll talk about the food stamps changes. Well, let's start with food stamps, because that's one thing that it has immediate effect that is going to hit seniors immediately. So SNAP benefits are now going to be based on the 2021 Thrifty Plan, with a small room for adjustment on an annual basis. What does that mean? It means that in 2021, the SNAP Thrifty Plan um, is the baseline they're going to use for future increases. And the future increases are going to be very small based on inflation. And so they've also reduced how much you can get based on your household size. So a one person household can get 30% of the maximum benefit. A four-person household can get 100% of the maximum benefit, and an eight-person household can get 180%, which means that they are limiting how much you can get, the maximum benefit you can get. And they're also putting strict work requirements. So if you're an able-bodied adult without dependents, without children or dependents, you have to work at least 20 hours a week or 80 hours a month, or volunteer, or be in a job training program that is approved by your state. And you have to be 65 years or less. So essentially, if you're a senior citizen, what does this mean for you? Well, previously the work requirement ended at age 54. Now it's been expanded to age 64 and a half. So you have to work till age 65 pretty much to get, or continue to get, food stamps benefit. Also, there used to be a way to deduct utility allowance, the utility um, cost from your food stamps, so that you can get more benefits. So it was a deduction that you can take, and then allows you to be able to qualify for more food stamps. That has been limited to household with elderly or disabled people. And then internet services is being excluded. So you cannot deduct your internet costs as part of your food stamps eligibility requirements. And then states are also being forced to pick up more of the slack or more of the tab for food stamps. So, federal reimbursement is going to drop from 50% to 25% for states' administrative costs. Previously, the federal government paid states for 50% of how much it costs them to run the food stamps program. Now, the federal government say they're only going to contribute 25%. So states will have to take up more. In addition, if a state has an error rate, means that if they are not running the program properly and are overpaying or underpaying people for food stamps, and their error rate is more than 10%, then they are going to have to pay 15% of the food stamps program. I think this is where a lot of people need to pay attention to, because when cost is being shifted to states, not just in the food stamps program, but also in the Medicaid program, states have to balance their budgets. And so if the states cannot afford the additional costs that the federal government is pushing on them, they're just going to drop people from the programs. So expect states to tighten there are rules and requirements for food stamps and Medicaid because of these new requirements. And while we are on it, let's talk about Medicaid. So if you're on Medicaid, the federal government is shifting more costs to states. States, especially Medicaid expansion, states are going to now be responsible for 20% of the cost instead of 10%. And that is going to shift billions and billions of dollars to states, and some of them may not be able to afford it. And so they will just drop more people from the program. In addition, there's work requirement for Medicaid. You have to work until you're 64 and a half, just like food stamps, in order to get benefits. You have to work 80 hours a month or be in a job training program or volunteer in order to get it, unless you are a parent with a child under 15, disabled, or you're an elderly person age 65 and above. And also, there is strict eligibility for non-citizens, even legal permanent residents who are here legally paying taxes, who are eligible for Medicaid. Now there's very strict requirements that limit their eligibility. And then for Medicare, there is some changes that are happening where people who are here legally that could buy into Medicare, only US citizens are now eligible for Medicare moving forward. So green card holders and other legal permanent residents are going to lose access to Medicare. They can no longer buy into Part A of Medicare. And previously, non-citizens get access to the extra help program for Medicare, and that is also being taken away. And so these are some of the changes that are going to happen. And if you are, or you know somebody that's buying healthcare through the Affordable Care Act marketplace, meaning that their employer does not provide Medicare or healthcare coverage, and they don't qualify for Medicaid, so they have to buy their own insurance on the Affordable Care Act marketplace. And the federal government was giving them subsidies to afford healthcare. Well, those subsidies are largely going away or have been severely limited. And so here's another area where changes are being made to the healthcare program that you need to pay attention to because it has consequences for your benefits. And then the last thing I want to talk about is an emergency rule that just happened with the Social Security Administration. And this was an internal memo that was distributed by the Social Security Administration to their members or their employees. It's called EM Emergency Message 25040. So as I said, this is a memo, internal memo that had a lot of Social Security language that was supposed to be communicated to the employees. And I've done the research, read it, and now I want to unpack it for you because it has a critical deadline that you need to pay attention to. And that date is September the 30th. And if you are getting paper checks in the mail, the government is no longer going to mail your Social Security check through the mail. Why are they making this change? Well, it's because Doge came in earlier this year with Elon Musk, and one of the changes they wanted to make was stop paper checks because they suspect that there's a lot of fraud involved in that. And so the president issued an executive order 14247, and the aim or the goal is to instruct the Social Security Administration to stop sending out paper checks. So now the Social Security Administration has set a date, which is September the 30th, where you can no longer get paper checks. Now, there are waivers and exemptions that are happening with this, but they are making the waivers and exemptions much, much harder. So if you are in a certain category of people, there are only 3 categories of people that are allowed to get waivers. If you have a severe mental impairment preventing the use of electronic payment, if you live in a remote area without access to electronic payment infrastructure, or if you are ineligible for Direct Express card. The Direct Express card is a debit card that allows people to get federal government payments if you are not able to get a bank account. So these three categories of people are the only people that can get exemptions, and now you have to apply for that through the United States Treasury Department. Previously, if you want to continue to get paper checks, you can apply through the Social Security Administration, your local office. No longer can you do that. You have to apply through the Treasury Electronic Payment Solution Center, and you have to call 1-800-967-5042 to request a waiver to continue to get paper checks. So essentially, they've made it harder to get paper checks in the mail. You have to get electronic payment. So what can you do now? You have to open a bank account or sign up for the Direct Express debit card. And if you need a waiver, you can no longer get it from the Social Security Administration. You have to get it through the Treasury Department. So those are the things I wanted to talk to you about. And before I leave, let's talk about Medicaid very quickly. There is our chapter partner, Chapter Medicare, that we've been working with, and over 2,000 of you have called them and gotten help in getting into the right Medicaid program. Why is this important? Well, because the Trump administration has been cracking down on deceptive practices about Medicaid benefits, Medicare, sorry, where seniors have been put in the wrong Medicare plans. And Chapter is in business to try to help solve that. They are in your corner helping you get into the best Medicare plan possible. Why is that important? Because here's the thing, you can get more out of Medicare in your lifetime than you can get in Social Security benefits. If you understand how much healthcare costs right now, a simple surgery is $20, $30, $40,000. That is what you get in the entire year if you're lucky in Social Security benefits. And so being in the right Medicare plan and getting the benefits you deserve and have earned is important. And that's why we're partnering with Chapter. Call the number you see on the screen, 539-205-2147, or go to the special website they've created for us, askchapter.org/insider, and fill out a form. And I'll include the form in the comment section to this video and in the description. You can fill out a quick form. It takes just a few minutes, and then they will reach out to you and see if you are in the right Medicare plan. And if you're not, they'll help you get into the right plan. But there may be a small window to be able to switch to a better plan. So call today and get help, because these are the guys that are going to be helping you when you call them. Real people, licensed agents that are ready to help you. And you can save $1,100 a year, which in today's market, in today's age of high inflation, that is a lot of money that you can put back in your pocket. So Chapter is highly rated, A+ with the Better Business Bureau, tons of 5-star reviews you can read for yourself online. These guys are the real deal. Give them a call today. So that is all I wanted to share with you today. I will be running another live tomorrow. So until I see you, if you like what you heard, hit the like button, hit the subscribe button, and I'll see you tomorrow. Thanks for watching.